Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. I'm here to answer all your questions about skin, health, beauty, and wellness, and take you behind the scenes of my practice. If you have any questions you want me to answer, send me a DM on Instagram at Skin by Dr. Azi, and I'll be sure to answer them on the show. Now, let's get started. Well, hello, everyone. Welcome back to the More Than a Pretty Face podcast. I'm Dr. Azi, a board-certified dermatologist, and I'm here today with Lacie, who is my right-hand woman. She is also my podcast host, my office manager, my life manager. How are you doing?
And I'm a nurse.
She's really a nurse. She's Nurse Lacie. How are you doing?
I'm doing good. How have you been?
Good. You're halfway through the matcha. That means
yes.
We're gonna get we're high energy today. We are. It is Monday. We are ready.
Yes,
Start
I'm so
the week.
excited for this episode.
So you have a beauty and blemish?
I do. So my beauty is not that long ago. I had Eleni treat my jawline and neck with tox.
With Botox?
Yes. And the amount of compliments, even in the first 2 weeks that I received, was insane.
I love neck Botox.
Oh my gosh.
Neck and jawline.
Yeah.
Especially in your late 30s,
early 40s,
40s, early 50s. It works really well.
Yes. For lifting, kind of like a lot of people are like, wow, did you lose weight? And I'm like, where? How did you just look slimmer in this area? And I'm like, it's not my cheeks. Those are still really big.
Well, that's good. You want big cheeks. That's volume. But the reason it works so well is this platysma muscle, which is this muscle that's the muscle of the neck. Mm-hmm. And then it kind of goes up over the face like this. And it's this massive muscle. It's huge. It's thin, but it is big. And so by relaxing that muscle, it's not pulling down on your jowls and your jawline. And once it's relaxed, it gets lifted up, right? So the neck smooths, you see a little bit of lifting in the neck area because that muscle is being opposed by the lifters. And so that's why it works so well. I also love it for those platysmal bands, which become more prominent as we get a little wiser. They become more noticeable. And so by relaxing the bands, it can also give you just a more, what do they say? Snatched jawline
snatched
and
is
neckline.
What I've heard. Yes. I'm like, okay, I'll take snatched any day.
But caveat, this happens to me. I don't know if it happened to you, but I have a hard time swallowing after. And like if I try to do sit-ups or like Pilates, it's like, what's happening to my neck? Like,
yes.
The neck can weaken,
yes.
right?
Yes.
Did you notice that?
I didn't
that
have it that bad this time. I don't know if it's because we treated the jawline
Mostly
too,
the jawline?
But no, we did my neck bands and it was unusual. I didn't have like so much the tenderness, which I've had before, but I did have the swallowing where I was like, oh, yeah, I had Botox.
It doesn't happen to everybody, but it can happen.
Mm-hmm.
The good thing is it goes away. But, so I did trap tox.
Oh, yeah.
You
How
know what
was
trap
that?
tox is? When we relax part of your trapezius muscle, and some people call it the Barbie tox because by relaxing the muscles kind of at the base of your neck, it gives you the appearance of a longer neck, kind of a more defined neck silhouette, if you will. And if you're one of those people that's, constantly kind of looking down with, a tech neck, it can also help with that because your head is heavy, right? And if it's hanging over your spine all the time, then the trapezius muscle up here has to work really hard to keep your head up. And so I loved it. The problem is...
I know, I was just going to ask,
I'm getting to the story. When you combine it with neck Botox...
Oh, no.
Then it's like, whoa, what's happening to my head? And is it even being held up? Because now my neck muscles are weak.
Oh, my God.
So I've knocked out the front and the back. I wouldn't advise doing those together.
Right. That's so
funny.
funny.
I have to alternate. But that's been my thing. Is like, oh my God, I'm kind of like going forward like this because my muscles
Does it feel
are
like
too
your
weak.
head is so heavy?
Yes, it does.
Like a big bobblehead.
I'm probably recruiting other muscles to hold up my head because my neck muscles and my, the muscle right behind it, the trap muscles that usually hold. Anyway, another episode
Oh my goodness.
in the life of me trying these things in my office on myself.
Well, I have a funny story. I don't know if it's really like my blemish per se. It's a blemish, but I don't know that I can claim it. But my friend, we were talking one day. She was over for a cocktail and we were just talking. My friends always like to pick my brain for anti-aging and like in-office treatments and things like that, which I love. And she was smiling and she was like, yeah, I think I'm ready for Botox here and here, but I wouldn't do it anywhere else. And I was like, oh, you could really do it around your eyes.
Hint, hint.
Hint, hint. Like when you smile, you get these lines. I have them. Botox is great. Maybe even a laser. And she's like, oh no, these are dehydration lines.
Well, there's some truth to that. Dehydration can make your wrinkles look worse.
Worse.
Yes.
If they're there already, right?
Hint, hint.
I love you.
You look hydrated.
But you are very hydrated. You're the most hydrated person I know.
Well, this is a great segue because, guys, we are going to get into the eyes today. Yes. What do they say? The eyes are the soul's...
The window to your soul.
Yes. The eyes are the window to your soul. And you can... tell so much from how somebody is feeling about you, how they're feeling inside, just by the way their eyes look. Mm-hmm. And unfortunately, because the eyelid skin is the thinnest skin that we have on our bodies, it is also the one area that shows the signs of aging the fastest. It is the first area to show wrinkles and lines and all kinds of things. Dark circles. If you have too much salt, it's going to show it. If you have too much alcohol, you're dehydrated, you didn't sleep. Boy, the eyes give it away.
Yeah.
I guess that's why they say it is the soul. It is the window to your soul. People know.
But before we get into it, do you have a beauty and a blemish?
Well, I got to have dinner with Martha Stewart.
I was so excited for this. I'm so glad we're talking about it.
She's such an icon. She's literally in her 80s. She's just, standing there with her martini. We're talking about pearls and outfits and fashion and travel. Wow. And she is just so witty, so witty. And we're talking about a skincare line, right? And one of my friend who's a guru in skincare, he's like telling us, oh, it's this novel antioxidant that's coming out. And she just shut him down so quick. She's like, we are not going to use the word novel.
Oh.
Because when you use the word novel, people think, oh, like the novel coronavirus.
Oh, no.
I was like, well, that's where the marketing genius comes in.
Right.
But she's so sweet and so bright and so funny. And it was just really cool to hang out with such an icon.
It was, yeah.
And then I got to see Snoop Dogg perform.
Which obviously doesn't get any better.
So fun. But I'll tell you, like before he went on, I think he must have had a couple of joints. The whole place was like, very smelled like skunks. That's
the way okay.
It smells like. But no, he was awesome. He was such a good performer. And what was really funny was he was brought on by Neutrogena at this event.
That's so funny.
And he talked about how Neutrogena sounds like this hot girl, how Neutrogena did it right, because Neutrogena sounds like this babe, this supermodel that you want to like get with.
That is so funny.
It was really cute. But he's just a happy-go-lucky kind of guy.
Yeah.
Just still doing it,
I told you to take me. I would have been your camera girl.
Honey, I barely got in. There was so much security, and they weren't even going to let me in. My friend literally, it was my friend's party. He literally had to come out and tell them, I am on the list. Like, let me in.
Oh, my gosh.
You had to show your email confirmation. Like, there was 3 checkpoints before you even got into
Martha
the line.
And Snoop. That makes sense.
I mean, it was... But it was what a night. It was quite fun.
I'm glad you had fun.
Less than 48 hours I was there. So the travel always gets me. I'm getting
crazy
old
for
this. I cannot acclimate. I try, but it's hard.
It's hard.
So anyway, we have a great episode planned. But before we get started, guys, don't forget to rate, review, and subscribe. And make sure you check us out on Instagram at morethanaprettyfacepodcast.com. You can also follow Lacie at Nurse Lacie on Instagram. And I'm Skin by Dr. Azi. although people read it as Skin by Drazi. So, and if you don't have Instagram, God bless you. You are so lucky. You are God's favorite. And you can just send an email instead to morethanaprettyfacepodcast@gmail.com. We'd love to hear from you. So let's talk about the eyes.
Eyes. Well, for most of our listeners that know us well, know I have a huge eye phobia. So this is going to be a fun segment for us.
Yeah, some people do. Do. So let's talk about, you brought up Botox for eye wrinkles, right? And that's honestly the gold standard. There is nothing that's going to help your crow's feet and the lines around your eyes than things like Botox. And a lot of people get confused between Botox and fillers. I know that's really confusing. But Botox is sort of a generic term now because there are 5 Botoxes on the market. They are considered neuromodulators. So we all have this muscle, right, that goes around the eyes. It's a circular muscle. And every time you smile and that muscle contracts, it like squeezes the skin around the eyes and causes these little lines that are called crow's feet because they look like the foot of a crow. And so that muscle contraction over time, let's say you do that, 50 or 100 times a day, every day for 20 years, 30 years, eventually with collagen loss and sun damage and so forth, you are going to start to see those creases become more and more permanent. And so you want to start Botox before those dynamic lines that are only there when you're smiling turn into static lines, which is what Lacie's friend had.
And me.
And you. So Botox is really the gold standard in terms of simple things. Let's say, okay, you're not ready quite for injectables. If you're young and you are not using sunscreen around your eyes, huge mistakes.
Huge mistake.
Because again, that skin is the thinnest on the body and UV rays are going to damage that so much faster. So if you are not using sunblock or sunscreen, it's going to probably form much faster because you can have greater collagen loss. I personally love Eye Glow AM, which is a peptide serum. So it does help hydrate the skin. It helps with collagen stimulation, but it has SPF 50 designed for the eyes because I know a lot of people don't like putting on regular sunscreen around their eyes. It burns, it stings, and so they just don't do it.
Yeah.
Right? I mean, a lot
was
of
just
people
going to
think
ask
about
you that. I was going to say, for those that maybe don't want, or can you just put a normal sunscreen around your eyes?
You can. I would suggest a mineral one though, because yes, a lot of times that sunscreen might be fine for your face, but when you start using it around the eyes, a lot of people complain of stinging, burning, itching, those things. So I love the Eye Glow AM because it is formulated for around the eyes. It's a mineral base, and I love how it has this cooling tip that helps. I kind of go like this and I move the lymphatic fluid out of around my eyes. It helps reduce puffiness. But you can use just your basic zinc or titanium based mineral sunscreen actually, if you want. But sun protection is key. And wearing sunglasses, especially in the summer when it's sunny, because it's going to help you prevent that squinting motion.
Yes. Seriously, you guys, sunglasses, especially in California or Florida or wherever you are with constant sunlight. I mean, I feel like I'm a walking billboard for like sun damage, wrinkles, face, but you wouldn't know it because I have a really good dermatologist. But if you take my before photos, which I really love to show people, of like smiling and just like I had platinum blonde hair and super tan skin before I started in derm, and look at me now. But peptides is another great ingredient for around the eyes because the eyelid skin again is very sensitive. So sometimes using strong actives like retinols, which are again gold standard for wrinkles around the eyes. If you can't tolerate them, then using a peptide serum. Peptides are interesting. They kind of trick your skin into thinking it needs more collagen, and they can also be very hydrating. And so look for ingredients like peptides, retinol that you can be doing at home to boost the collagen and help firm the skin. I remember what I was going to say about sunglasses. Remember when Mia had a pterygium?
Uh-huh.
That was from too much sun, right?
Yeah, so you can, if you get too much sun, you can actually scar your sclera.
Yeah.
And so that's actually quite common in San Diego.
Yes.
We see it with surfers, people that don't wear sunglasses, and they can end up with almost like scar tissue over their sclera. So not only for the skin,
Yes.
but also for the eyeball, sun protection is key.
Okay, so we talked about Botox around the eyes for, the expression lines, but what about the lines?
Crow's feet, yeah.
Yeah, the crow's feet. But what about the lines that maybe are still there after you have your tox treatment? What are some things we can do for the wrinkles that are still there?
So that's a great question. And a lot of people think that Botox helps with the lines under their eyes, and it actually doesn't.
No.
So people try to put Botox kind of right under that lash line, thinking those lines are going to go away with Botox. Unfortunately, it doesn't work that way, because the way the muscle contracts, that area just doesn't work in softening those lines. What can happen though is if you're older and you have eye bags, if that part of the muscle gets relaxed, you can actually get worsening of your eye bags. So be cautious of putting Botox right under the lash line. That could be a potential side effect. Now, if you're younger, you have tighter skin, it can help open up the eyes a little bit, so it can change the shape of your eyes. If you put too much, you can get dry eyes. So again, that's a little tricky area. So Botox doesn't work for all the lines around the eyes. So if you still have some that you're bothered by, lasers are the best for that area. And it just does such a nice job of smoothing, tightening, getting rid of those etched lines. People complain about that crepiness under the skin. So laser resurfacing, like with a CO2 laser or an erbium laser, or sometimes combining the two, can work really well at targeting some of those lines.
So one of the biggest questions we get on Instagram and sometimes in office is, when you're doing those eye laser treatments, do you need a shield in your eye?
100%, because otherwise you can damage your cornea and potentially go blind. There's lots of
Risks.
Bad things that can happen. And a lot of times you can't see the shields because they're actually inside the eye.
Yes.
And depending on the type of shield, because we have ones that don't have those metal things that stick out. But if you're seeing CO2 around the eyes, that person better be wearing metal contacts that go inside the eye to protect the eye. And no, it does not hurt going in. You don't actually even feel them.
No.
Yeah.
I wouldn't know. Personally,
I've had them in several times, and it's actually quite easy to put in. Now you can get what's called a corneal abrasion with those shields, in that you can get, it's almost like a paper cut, but on the cornea. So you have to be really careful. Hopefully whoever's doing your treatment has a lot of experience and has the right techniques for doing them. But yeah, lasers around the eyes are highly, highly specialized. You have to be really careful with that organ, with that structure. It's a lot of potential risks when it comes to resurfacing around that area. But hey, if you get it done, it looks phenomenal. It's very dramatic. There's really nothing like it.
Okay, so what about just laxity around the eyes? Maybe somebody's not ready for a laser. Maybe it's not that severe yet.
So laxity, because maybe some of you don't know what that means, but laxity means loose skin around the eyes. Usually you're the one that's, telling me not to use medical terms.
You're right.
But yeah, laxity or loose skin around the eyes is something that happens to the best of us. And I have to say several factors, certainly genetics play a big role, because we see sometimes people in their 30s that already have, that excess skin, that loose skin, particularly on the upper eyelid. But some people, we don't see it until they're in their 50s. So it really varies based on your genetics and how well you've protected your skin against environmental damage. So UV rays, going back to the sunscreen, as well as other factors like smoking, squinting. I have a theory that, by not pulling and scrunching that skin over time, which that's what Botox treats, I think we can delay eye lifts, because I don't think that skin gets stretched out as much.
Interesting.
If you think about it, if you're constantly pulling and tugging on that skin over time, it's going to be more likely to, stretch out and become looser, right? So
Right.
I do think Botox also helps with skin laxity. Now, I have to look up to see if there's been any studies on that, but I guess you'd have to use Botox on one side of the face for someone and not use it on the other side. I don't know, but just my observation
Yes.
in office, I do think that it helps with the loosening. But if you already have the loosening, that's where we're going with
Yes, this is where Kentucky. No.
So in terms of loosening, loose skin, you have several options. Let's say you're somebody who doesn't want the downtime, you're not into getting cuts and sutures, and you don't want to look like Freddy Krueger with a laser resurfacing that's super aggressive. Then you can do like a radio frequency ultrasound skin tightening. I personally love Exelis, which we have in our own office, and it has radio frequency and ultrasound, and they use heat. So they work underneath the skin. They use heat to tighten that skin.
Yes.
Do need several sessions, right? And it takes a few months to really see the results. But I do it every year. I do 4 sessions every year. And what's nice about it is that there's not much downtime.
There's no
because it
downtime.
works under the surface of the skin. So lasers actually treat the surface of the skin, whereas things like Exelis, radiofrequency, they work from beneath the surface skin. So I like Exelis also because I don't think it melts your fat. It doesn't go deep enough. It doesn't go really past the skin, because there are some RF treatments that are really aggressive and they can melt your fat. Which is, you need the fat around your eyes. Or filler.
Yeah.
So I love that. And then at some point you may have too much loose skin, right? If you have too much loose skin,
then you need surgery.
then really you just have to cut that skin out and suture it or laser the skin out. So I do something called laser blepharoplasty, which is instead of using a knife to cut the skin, I use a laser beam to cut the skin. And I find that patients recover faster, results are better. And that is because you don't get the bleeding like you would with the knife. Yeah. Now, it's not good for somebody with darker skin. Somebody with darker skin, I'm using a scalpel. But somebody like you, we would use a laser to cut the skin and then we'd suture it back together. Now, it is an art.
It's
right?
very much an art. I was just going to say, like, even just a layman person that's not in the field, you think of lasers as like full face treating, or fractionated. You don't think of it as cutting.
Yeah, but essentially that's what you're doing. You're vaporizing the skin. You're ablating, whatever word you want to use, you're ablating the skin. And the problem with eye lifts, if you take too much skin, then that person looks surprised. Like they look too hollow, they look too surprised. So it can be really tricky with eye lifts. You have to make sure you're not taking in a lot. You can always go back. And if you take too much, you're almost going to look too surprised, I think.
But also from what I've heard is if you do take too much, then they have problems later on with dry eyes because their eyes don't close all the way.
Eyes. Yeah, so it's really tricky. So make sure you look at before and afters. You make sure that person has a lot of experience with that. And again, it's how you design the incision and how it's going to lie. Usually you should not be seeing the incision. When we do this, it's buried in the crease of the eyelid. And I just do this with local anesthesia in the office. So we don't actually put people under general anesthesia. No. It's such a simple procedure, and the sutures dissolve in a week, and you can have some swelling, some bruising, so be prepared for that. A lot of times I will combine it with a laser resurfacing, so we do the two together, because that's when you see the ultimate rejuvenation, right?
Yeah, the results are
amazing. You tighten that loose skin. Now, some people have so much loose skin under their eyes that lasers alone may not be enough. And in that case, we do something called a skin pinch. But always try to do laser first, because sometimes you get enough tightening where you don't need that. But a skin pinch is exactly what it sounds like.
Yeah.
You take a little of that loose skin, you pinch it, and then we make a little incision right beneath the lash line and take out that loose skin, and the scar virtually disappears. You don't really see it. So those are surgical ways for somebody who's got so much loose skin, it's sort of beyond lasers and radiofrequency that they have to do more of the surgical route. But nevertheless, the non-surgical ways are still rejuvenating.
Yes.
So it's still a good idea if you're hesitant about surgery and you want to try something, less invasive, then I think it's still worthwhile.
And this is why the consultation portion of your appointment is so important.
So important, because you have to go over the options, the risks, the benefits, and ultimately, I always tell patients, you are the most important person in the room.
Yes.
It's not me, it's not Lacie, it's you. So you have to decide what feels right to you. And I always encourage patients to see multiple providers, because you really have to trust that person. You really have to, have faith in that they're giving you the right information and what they're presenting resonates with you.
Yeah.
So all of that is really important.
Okay, let's talk dark circles, because we have so many patients that come in and they're like, I have dark circles, I want filler.
Such a popular statement. Like, give me filler because I have dark circles. Because they've seen, this is the problem with all this information online. It's really hard for the consumer to decipher, what is filler? Why do we even use filler?
Right.
And then really know what dark circles really are and all the different causes. Because I have dissolved so many fillers from other med spas that come in because they went in asking for filler for dark circles. And of course, the provider just filled the under eyes with filler, and then their dark circles gets worse. So it's an ongoing battle. So dark circles have a lot of different causes, and I actually have an entire YouTube video dedicated to dark circles. But the only time filler works is if you have hollowness. So if you have hollowness under your eyes that's casting a shadow, contributing to dark circles, then yes, fillers help.
Yes.
And we do a special type of filler called Eye Glow, which is a white opaque filler. And because the eyelid skin, again, is very thin, and if you put a clear filler, like a hyaluronic acid filler, which is what everybody uses, under that thin eyelid skin, what happens, Lacie?
Tyndall effect.
You get a Tyndall effect. And what that is that light scatters through that filler, and it causes this blue-gray hue. That's the reason on a clear day, the sky is blue. So you don't want that, because that will make their dark circles worse. So Eye Glow, you can't see through it, so light can't pass, and it's white. It's almost like concealer, helps lighten and brighten the under eyes. So not only are we lifting that under eye area with the Eye Glow filler, but also the white helps brighten the under eyes as well, and you can't see through it. So that placement of the filler is so, so important, because if you are just pumping filler in there and you're putting it on the surface of the eyes, it can actually make your eyes puffy.
Yes.
Not only can it make it like blue-gray, the Tyndall effect, but it can cause puffiness.
Right. And sometimes it makes it look like it's a dark circle.
Yeah. Sometimes it worsens dark circles. So be careful with that. And with Eye Glow, the results last for many, many years. I don't think we've had a lot of people where of course you go back to aging. People say, well, is it permanent? It's permanent to a degree, but you also go back to aging. So you'll continue to lose volume and so forth, but it stays for many, many years. I've personally had it done twice.
Yeah.
It doesn't really move. People say it doesn't move. It doesn't move because of the way it's placed. A lot of times if you put the filler in a plane that can easily migrate, then it could possibly move. But if it's placed really deep and if it's integrated into the tissue, this is where the injection technique is so, so important, is how you integrate that filler into the tissue. Yes, if you just put a big glob in a one plane, then it can migrate. But there's a lot that goes into it. So
what about veins?
Oh yes, that's another contribution to dark circles. You can get pooling of the blood there, and actually the blue veins kind of make the skin a little bit darker. So another popular treatment is we remove them with a 1064 YAG laser. It works really well. And they're gone. I mean, they're permanently gone. And patients do really well with that.
And then just genetics.
Yeah. Just, ethnic variant. A lot of times if you're Middle Eastern or you're, Asian, you might just have natural darkening of that eyelid skin as you age, because that's just what happens to that area. So that could just be a natural variant.
Or not natural. It could be a dermatitis irritant.
Yes, that's a great point. A lot of people don't realize that their dark circles, that their lines and wrinkles are from a medical condition.
Yes.
That's why dermatology is so important to have a consultation. So yes, if you get, red, peely, dry, itchy skin around your eyes, well, guess what, guys? That skin is going to turn brown. It's going to turn dark. And it's going to accentuate your lines. You're going to have more lines than you did before because that's what eczema does. It just makes the texture a lot thicker. It makes the lines more prominent. So sometimes you just need a prescription cream and management of your eczema to improve the eyelid area.
Yeah.
Well, this was so good. We touched
one more.
Oh, okay, one more.
Okay, one more. Fat pads under the eyes. We can't forget fat pads.
Talked about hollowness. Okay, the fat pads. Fat is good. And so what I see is
sometimes, right?
Is, well, with age, you can get what's called herniation and buildup of the fat. And that's what people call eye bags. And what can be done is they can be surgically removed, although I have seen a lot of times people have all the fat removed and then they're left with hollowness, and then they come in for eye glow and we've got to add more volume to that area. Another alternative option is you can take the fat pads and surgically move them down to where you have the hollowness, and that's called transconjunctival fat repositioning. That's not something I do, but a oculoplastic surgeon would do that. It can be a little tricky. The fat can move back up sometimes. So again, skill, experience is key. Let's say you don't want to have surgery. You don't want to see an oculoplastic surgeon.
No.
So then we can do a non-surgical fat eye bag removal. And that is using a device called Agnes. It's this tiny little needle that goes into the eye bag, the fat pad, and it melts it. It uses RF, radio frequency, and heats the fat and melts it. And we
can hear it.
We can hear it sizzle. I mean, that
it's
fat
like
is like a barbecue.
It
is so gratifying. You can
really is.
Every time it melts that portion of the fat bag. The downside is you have to do it several sessions. And it can, you can still have the swelling, the bruising. So it's not like completely, no downtime. So those are factors to keep in mind. But what I love about it is it's fat reduction. So it's eye bag reduction rather than complete removal. So we do the sessions until we get to a point where you have, a good amount of fat that's giving you plumpness, but not too much where it's causing, eye bags to protrude. And so I do love that treatment. It works really well.
Yeah. Okay, now you can say this was a great episode.
It was a really great episode. Well, I love the eyes. I do a lot of eyes. I don't know how I got into eyes. I think I just, I guess they are the windows to the soul.
They are.
And so I do enjoy eyelid rejuvenation, if you will. Yes. So thanks, guys, for tuning in. I hope this was helpful. And until next time.
Bye.
Bye, guys.